the present members was not being expressed through the vote. And so this amendment asks to change section 4F on voting. It currently says the majority of seats per ORS 174.130 will be how is voted, and I simply want to change that to be the majority of members present at the meeting. The Oregon statute that's cited there simply states that voting in Oregon will be done by a majority, but I consulted Eliza Kaplan at Lewis and Clark Law School, and she assures me that the quorum, the way the legislature in Oregon works is you establish a quorum, which is also in our bylaws. Once you have the quorum, which in our case would be 7 members, then after that is when you could have a majority vote. So it simply would allow us to pass measures without a cumbersome process, because we've had many meetings, unlike this one, where many of our members have not been present.
Thank you. This recommendation is called the recommendation to define outcomes for substantial compliance. It follows the public testimony, which was overwhelming, that they feel substantial compliance is premature, and it's almost impossible to define what success looks like without outcomes. And I'm just going to read it briefly. So it says, whereas the compliance officers conclude that the City of Portland and the Portland Police Bureau have reached substantial compliance in the Department of Justice settlement in case yada 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 as laid out in their quarterly report dated October 3rd, 2019, whereas steps have been taken by the Portland Police Bureau to address issues raised by the Department of Justice settlement. They've crafted engagement plans, trainings, and policies, among other steps. In doing so, they have included the public and pccep in shaping these plans. Whereas while we, the pccep members, believe these actions are a step in the right direction, we believe an assessment of substantial compliance is premature. There is not enough evidence to determine substantial compliance. The assessment is based on outputs where the focus should be on outcomes. Whereas the Portland Police Bureau continues to make strides in improving relationships with marginalized communities, there remains a large gap in trust with many marginalized communities of Portland, including the African American community and other communities of color, the houseless community, and the mentally ill community, among others. The death of Andre Gladden highlights the deadly consequences of PPB's continued struggle to engage with persons of mental illness and African American community members. Additionally, according to an Oregonian analysis in 2017, over 50% of the arrests by PPB officers were houseless individuals. The PPB's own data shows that half the use of force incidents in the last 2 years were of houseless people. Furthermore, a 2018 City Budget Office report highlighted the disproportionate arrest of Black students at Portland Public Schools. These are but a few statistics that highlight areas of concern that must be addressed if substantial compliance is to be affirmed. Whereas assessment of paragraph 84 of the settlement agreement highlights scenarios and trainings implemented by PPB, which is the output, more time is needed to assess if this positively impacts behavior of officers' interactions with community members, the desired output. And as Mr. Rosenbaum had stated, it's too early to assess if these things are actually working. Assessment of paragraph 89 acknowledges the work of the Unity Center to provide mental health services, the output. However, pccep has concerns about the effectiveness of Unity Center to adequately support the needs of those suffering from mental illness, the outcome, and there's a recommendation that we'll talk more about that further. More time is needed to work on the deliverables of these and other paragraphs of the settlement agreement and show true and sustained success. Whereas the aforementioned statistics and questions cast doubt on the assertion of substantial compliance has been met, PPB and the City of Portland should continue their effort to better serve all communities of Portland and further articulate what success looks like. The compliance officer should further evaluate all sections of the settlement agreement and provide an update of the progress of PPB in the city and their fourth quarter report. Resolved that the Portland Committee on Community Engaged Policing, number 1, disagrees with the assessment of compliance officer assessment of substantial compliance, recommends that the compliance officer further assess the sections of the quarterly report dated October 3rd, 2019, and allow more time for the outputs to demonstrate the desired outcomes. And number 3, recommends that the Portland Police Bureau and the mayor more clearly articulate what their desired outcomes are based on the required outputs detailed in the Department of Justice settlement agreement. Therefore, be it resolved that the Portland Community Engaged Policing recommends that Chief Outlaw and Mayor Wheeler work with pccep and other community partners to define what true substantial compliance looks like to the community of Portland. This can be done by articulating clear outcomes, as was mentioned numerous times tonight, that align with the outputs as established in the settlement agreement that are acceptable to both PPB and the community in order to establish substantial compliance. We further recommend the compliance officer defer assessment of substantial compliance until further progress can be evaluated. Below is a summary of that recommendation in more easier to read terms. Patrick.
We have Meredith Mathis here tonight to speak to us about our two recommendations, and I do want to recognize Mark Shore and Timothy Russell, both members of our subcommittee.
Thanks for being here.
My name is Meredith Mathis. As Patrick said,
We can't hear you.
You can't. Is that better? Okay.
There you go.
All right. So we have two recommendations, both related to item 89, but they're separate but both connected. And so COCO had stated that the Portland Police Bureau and the City of Portland have substantially complied with item 89, which specifically details that a drop-off walk-in center be established. And they had listed the reason for compliance being that the Portland Police Bureau and the City of Portland have effectively partnered with the Unity Center for Behavioral Health. So the first issue is that Unity is not a walk-in center. It's not just that it's not a sufficient walk-in center, it's that it is by definition not a walk-in center. It is a hospital-level psychiatric emergency service. It was never intended to be a walk-in center. We have a list of bullet points we provided in the recommendation itself that we want COCO to consider. One of them is the memo that was written by Daryl Walker, the Chief Executive Officer of Cascadia, and Jeffrey Eisen, the Chief Medical Officer at Cascadia, in which they detail from an experienced professional perspective what constitutes a walk-in center. And they specifically distinguish that from a hospital-level psychiatric emergency service. That is what Unity is. In addition to that, we ask that COCO consider the safety issues that have arisen at Unity. There have been well-documented instances of patient death, patient on-staff assault. There have been OSHA complaints, OSHA citations, abuse investigations, and we ask that COCO consider this, that if Unity is overwhelmed and had so much dysfunction that because of this, there were many days where Unity had to be on diversion. So if police wanted to send somebody experiencing a mental health crisis to Unity, it would have to be diverted to another hospital. And then in addition to that, we ask that COCO look at the testimony provided from persons who have been patients at Unity Center. And we've noted that police officers can have people experiencing a mental health crisis transported by ambulance to Unity Center, but multiple reports show patients often escalate in this process, leading to more police involvement and an escalation in force, resulting in arrest, incarceration, or forced hospitalization. Overloaded with patients, Unity has frequently diverted patients to be boarded in hospital emergency rooms, forcing behavioral health care providers to find other options. Multiple reports describe Unity alone as an insufficient response for persons in a mental illness crisis in our city. We urge that COCO reevaluate and update its classification of item 89 of the settlement agreement. And Dr. Rosenbaum did note that the settlement agreement doesn't have to do necessarily with outcomes and that we have to look at the actual language of the settlement agreement. But I think it's safe to say that in item 89, the United States expects that there will be a walk-in center and drop-off center established, and so Portland Police and the City of Portland can't exactly comply with that, or working with that if it doesn't exist. Okay, and then the second recommendation we have is a way that the City of Portland can comply potentially with item 89. And that would be to support the Multnomah County Resource Center that is being developed. There was a lot of focus from Dr. Rosenbaum about the scope of responsibility and what the Portland Police can do. There wasn't a lot of mention of the City of Portland's responsibility. And even in the description of why item 89 was found in compliance, it had to do with the Portland Police's attendance to transportation subcommittees at Unity. It didn't mention the City of Portland's involvement in establishing a walk-in center. So from our recommendation to support the Resource Center, no negotiations by the city were started with HealthShare Oregon, the current CCO, or with Multnomah County, the sole provider of funding for services for people on Medicaid seeking medical treatment for mental illness or addiction. So to that extent, the scope of what the city can do in relation to the settlement has not been met. So capital development is well underway and documented elsewhere for the developing center. Remaining are operating costs. It's likely most or all of this ongoing cost will need to come from county general funds and not CCO, state, or federal resources. A substantial area of cost is payroll for peer-delivered services, including engagement, peer support, security, quality assurance, and training, and management. After attending county planning sessions, we estimate peer services will be about 25% of operating costs for the Resource Center. So the Subcommittee for People with Mental Illness recommends the City of Portland contribute 25% of the operating costs for the Resource Center. And that would meet, the Resource Center would meet the, I just turned it off. Can you still hear me?
Is it on?
Is it on?
No.
You can use that one.
See, the light right here is out.
I think it's back on.
It's back. Woo!
All right.
Okay, well, I'm just wrapping up anyway, but we're recommending that the City of Portland contribute 25% of the operating costs for the Resource Center, and the Resource Center would meet the definition of a walk-in center, as well as afford the City of Portland the opportunity to take responsibility for that item of the settlement. And be found in compliance. Okay, I'll wrap it up there. Thanks.
Thank you. Could you say your name one more time, please?
Meredith Mathis.
Thank you, Meredith.
Thank you.
We're going to open this up
You did
to
good.
2 rounds of comments, one from pccep. It'll last 10 minutes to 8:20, and then we'll have public comment from 8:20 to 8:30, and do our votes right at 8:30. This will be open to all 4 recommendations that were just presented. Whoever wants to start from pccep.
I'm good.
Do we just want to go down the line? Let's ask Vadim then, if he's on the line, if he wants to.
Dean, are you still here?
Yes, I'm still there.
Do you have any comments on the 4 recommendations?
I
I do have comments on the recommendation with respect to substantial compliance. Can I be heard by the microphone right now?
Oh, yeah.
Okay. So with respect to the substantial compliance recommendation put forth with respect to having the COCO review again whether the city and the police department are within, police bureau are within substantial compliance. I think the terms of what a substantial compliance means is laid out in settlement agreement, and it specifically says that substantial compliance is achieved if any violation agreements are minor or occasional and non-systemic. I would like to hear more information at some point in time as to why there's a disagreement as to whether the violations, if any, are systemic versus what the compliance officer found was that they're non-systemic and happen from more of a minor occasion. So because it is a settlement agreement, because the terms are outlined within the settlement agreement, and because it's really up to the Justice Department to agree or disagree with the compliance officer's recommendation, I'm not sure to what extent the recommendations that PCCEP can make for the compliance officer to review whether there has been sufficient compliance is in keeping with the settlement agreement or with the fact that the Justice Department has